Hi, my name is Sabrina Marie Kester, and I'm just going to be taking a look at the return of bowel sounds indicating an end of post-operative ileus is a time to cease this long-standing nursing tradition. And the author of this study is Robert L. Massey. So the main problem of this study is to see if those bowel sounds are a good indicator of the end of POI, and this is also associated with the Iowa model of evidence-based practice. So the significance of this study is it reliable enough? In today's practice, nurses auscultate each quadrant for a minimum of 5 minutes, and the real question is this reliable enough? There are other indicators to assess the end of POI. This includes nausea, vomiting, diet tolerance, abdominal distension, pain, and there is no study question or research question other than is this reliable enough? The conceptual model or theoretical framework uses the Iowa model of evidence-based practice, and this just really questions the use of those bowel sounds. What Massey also does is he pulls other studies to support his findings. He uses Madsen and co-authors to really look at how healthcare professionals use those bowel sounds in everyday practice. And it also takes a look at 3 concepts that are indicators of the end of POI other than bowel sounds. There is no theory or framework because it is a physiological study. So the variables in this study include independent, dependent, and research variables. The independent variable includes the rocking chair intervention. So this is going to be manipulated to change the dependent variable, which is the resolution of POI. That's going to change due to the treatment as Thane explains. The research variable includes as well the first flatus and the bowel sound. That's what we're really taking a look at in this study. And all of these variables were defined operationally. So the intervention of this study is the rocking chair intervention, and that is the independent variable of this study as well. And the primary objective or aim that Massey explains in the study is to see the duration of POI and how that rocking chair intervention affects that duration, if it shortens or prolongs it. This just really, Massey uses this just to support his findings of the studies of that first flatus or those bowel sounds. So what happens is the patient gets up out of bed into a rocking chair and rocks for about 10 to 15 minute increments for at least an hour a day until that first flatus is heard. This also provides a 2-group study as well. So the sampling method used is the quota sampling. That's just really specific characteristics found from a randomized population. So those characteristics include the inclusion criteria, which is the recovering from surgery performed to remove cancerous GI tumors, patients with digestive system cancers scheduled to undergo abdominal surgery, English speaking, cognitively intact, able to ambulate and sit in a chair or rocking chair, and able to receive patient-controlled IV or epidural analgesia. There was no exclusion criteria that Massey states in this study. The sample size included 66 patients that were split into the rocking chair intervention group and the non-rocking group. There was no power analysis, no acceptance rate, no attrition rate, and the setting of the study was in the University of Texas MD Anderson Cancer Center. So the ethical components was, before the study began, Massey obtained approval from the University of Texas MD Anderson Cancer Center and Institutional Review Board. Once he gained approval, he also got consent from the participants after explaining the purpose of the study and what is going to be going on in the study. This also provided any questions from the participant before assigning the consent form. So the data collection procedure, once the approval from the university and the consent form from the participant was obtained, the procedure occurred, and those who wanted to participate were split into that non-rocking group and the rocking group. There was a primary investigator that went every morning and assessed the patients at the same time every morning, and he or she also took a look at the patient's medical records to see if any of the nurses or any of the surgeons heard those bowel sounds. Even if it was on the medical record, that primary investigator still went in and assessed those bowel sounds or first flatus. And the documentation of the study was also done on a study data sheet as well. So the results of the study showed that there was no significant difference between the rocking chair intervention and those that just received standardized post-op care, and there was no association between the first flatus and the the vowel sounds as well. So the interpretation of this is really that the rocking chair intervention did not prolong or shorten the duration of POI, and that the vowel sounds are not quite a reliable indicator of the end of POI, and it's very questionable. There were no limitations of the study. Some limitations that may have been seen in this study are a small sample size. There was no hypothesis in the study to guide the study. There was no power analysis, acceptance rate, attrition rate, and the specific characteristics of the participants were quite specific, and it may have been difficult for Massey to find those participants. So the main takeaway that Massey really explained was for nurses to use the vowel sounds as an indicator with caution, and to try and find a more reliable indicator of the end of POI. As you can see, there are other ways to assess the end of POI, which is passage of the first flatus, elimination of abdominal distension, nausea, vomiting, and tolerance of diet. And this all just provides further opportunities for studies as well, because people can assess those other indicators. Another point that Massey makes is that even though vowel sounds are not a good reliable indicator, to still keep using it in today's practice until more research and more data are supported. So in conclusion, this really takes an impact on today's nursing practice. It can provide accurate and more comforting care for the patient, and the findings of the study actually support Madsen and co-authors and really question the use of those vowel sounds as well. This also supports the purpose of the study because it found that vowel sounds are not a good indicator, and the first flatus is a very good indicator. And it also just provides opportunities for further studies as well to see if there are better indicators than vowel sounds. Okay, and these are my references. Thank you.